Thank you for joining us on this video. This program is designed to show employers how they may benefit from using some supplemental health insurance programs to lower their overall cost of health insurance. This program is being brought to you by an independent insurance broker who represents only the finest companies and the finest third-party administrators. What I want to talk to you today is about the rising cost of health insurance and how some employers are bringing in some ways to cut the cost and improve the benefits for the overwhelming majority of the employees. As you know, when it comes to the cost of health care, there are deductibles, there are co-payments, and there are maximum out-of-pocket limits. As groups have had heavy rate increases since the onset of the Affordable Care Act, many employers have been forced to look at either increasing the premiums that they personally pay or utilize some cost-shifting strategies to their employees that can utilize higher deductibles, higher co-payments, and higher out-of-pocket maximums. For firms that want to mitigate some of the cost and some of the risk to the employees, they can bring in a supplemental gap insurance policy that will cover the cost and cover many of the gaps for their employees. What I'm going to tell you next is no surprise to you as an employer, but groups have been going up, some groups 8 to 15% a year, some have had worse rate increases than that. Another thing that's hurt in the ability to negotiate pricing is that so many of the doctor groups and hospitals are getting lower reimbursements for Medicare and Medicaid. It just does not give them as much room to negotiate on pricing. So therefore, the average cost of health care now is over $5,000 per employee. Those rates continue going up as employees are seeing instances where they're getting higher deductibles and higher co-payments. As an employer, back about 3 years ago, I had the distinct displeasure of meeting with the employees that reported to me, and the maximum amount we had to give in pay raises was 3%. In that particular year, their health insurance costs went up by more than 3%. So I had to sit down with our best employees and explain to them that they were a great employee and we appreciated the contribution that they made, but their paycheck was going to go down, and in many instances, so did their coverage. Another reason why I'm personally passionate about this is a couple of examples that I've seen in my own life. I have one of my own relatives that's working for a fine company. They give their employees 100% cost of the employee cost for health insurance, which is a tremendous employee benefit. But they have a $3,000 deductible. And in this instance, this particular family member has a chronic illness that must be managed on quarterly visits with a doctor. Well, when this person saw their specialist and had their routine testing done, the total tab at the end of the first visit was $250. When they discovered that they had to pay the full $250, they were distraught as money was very tight. The next quarter, when it came around for them to go to the specialist again, they refused to do it because they said they could not afford to go to the doctor. This just breaks my heart that a hard-working person who's putting their heart and soul into their job and a big contributing member of society feels they can't afford to get the medical care they need because their deductible is so high because the cost of health insurance has gone up so much. Now let me tell you a happy story. When we moved into our new office a few months ago, the person that was installing our copier machine, we noticed on their copier machine that their group had our gap coverage with Companion Life. And quite frankly, the install wasn't going too well, and I could tell the employee was getting frustrated. So I said, just out of curiosity, do you know about Companion Gap coverage? And that person lit up and said, yeah, we love it. At my old job, we had a $3,000 deductible on our health care plan, and so therefore, if we went to the doctor, we had to pay for it all, so therefore we didn't go very often. Now with my GAP plan, that pays for us to go to the doctors, and we feel like we can get our children to the medical care that they need. I have to tell you, as the provider of that benefit, it made me feel very good to know that we were helping this hard-working American family get better health care. Let's talk about why you as an employer may want to consider doing this. First and foremost, you could see an immediate decrease in the cost of your health insurance. Now, I'll be the first to tell you, GAP is not for every company. If you've already been using cost containment strategies, you may not be willing to invest any further money in something like a GAP program, so it's not for every group. However, in the groups where it fits, the normal cost savings is about 6% after bringing in the GAP policy. The second thing you'll notice later in the presentation, we're going to show you that this will benefit about 90 to 91% of your employees that will get better coverage. They're going to get first dollar coverage on things like deductibles and copays that they don't get at all right now, and your employees are going to love that. This is an actual example of the rates of my company. Small business employer to you. You can see that we were paying almost $1,785 for our Gold Health Insurance when we got our new rate increase for our July 1, 2017 renewal. We had no choice but to go down to the Silver plan and bridge the difference with a GAP policy. You can see that we had over $350 a month to work with on the full family health care. Our GAP policies averaged about $185 a month for the full family coverage, and we were able to take about half the savings and put it into a GAP policy that created better coverage for our employees while bringing the cost of the health care down for us. In our situation, the savings were more than 6%. This chart is what we call a claim stratification chart. It says cost stratification. It shows you exactly how much the average American spends on health care. Not their health insurance, but health care itself, what they pay out of pocket for their deductibles. It covers the entire cost of their doctor's visits, their testing, not just their deductibles and out-of-pocket expenses. As you can see, over 72% of Americans will spend less than $1,250 a year in health care costs. That very well may be you. Think about that person that goes to the doctor once a year that has no real health issues and goes and has a checkup, or maybe they take a little Lipitor for some high blood pressure, high cholesterol, things of that nature, but it's very routine stuff with generic medications. They would go in this low cost category. If you go from $1,250 to $2,500, that amount goes up another 11%. And now we're looking at over 83% of Americans will spend less than $2,500 a year in total health care cost. If you look at the next chart, about 8% will spend between $2,500 and $5,000. What that tells you is 91% of Americans are going to spend less than $5,000 a year for health care. In our old example, we were being asked to pay over $1,750 a month or $21,000 a year, and 91% will spend less than $5,000. This is a situation where the healthy, well people are subsidizing the cost for the chronically ill. What we like about GAP is GAP brings in a scenario where your healthy well are going to get better coverage and spend less money out of pocket, and the heaviest users of your plan are probably going to pay a little bit more out of pocket, which may make them think twice before they go to the doctor every time. But also, let me be perfectly clear, in about 9% of the times, your employees would be better off having stayed with the Gold plan and not having used GAP. We think it's very important that you understand GAP is not for everybody, it's not for every employee. What you have to make a decision on the employer is, are you interested in saving money and improving benefits on 91% of your employees? As you see in this example, we're going to look at a $2,500 inpatient claim. In this scenario, the employer is going to have a $1,000 deductible. So in red, you'll notice the first thing you'll see is the employee pays $1,000 out of pocket, their $1,000 deductible, before the health insurance pays anything. Then the health insurance pays 90% of the next $1,500, or $1,350. This leaves the employee paying $1,000 deductible and $150 in the out-of-pocket. That's called the copay. That means their maximum out-of-pocket in the extreme left-hand side of the slide is $1,150 out of pocket. On the right side, we have the same claim with a GAP policy. This gap policy pays $1,500 for an inpatient procedure and $750 for an outpatient procedure. And that's normal. These plans pay less for outpatient procedures than inpatient procedures. In this scenario, they pay a $1,500 deductible instead of a $1,000 deductible. And this health plan pays 80% instead of 90%. And that's how you, the employer, save money. Your employee is paying a higher deductible, and they're also paying more in out-of-pocket on their copay. If you look 2/3 of the way down the slide, you'll notice the employee has a maximum exposure of $1,700 out of pocket. But then we apply our $1,500 gap policy, which covers the first $1,500, and this employee has $200 out of pocket compared with $1,150 out of pocket. In this scenario, gap is far superior than your old plan. In this slide, we're going to look at a $2,500 outpatient claim. It's important to spend some time on this because in gap, the plans do not pay as much for outpatient care as they do inpatient care. Now, the first thing you should wonder is, well, about 2 out of 3 procedures are outpatient care versus inpatient care. And the reason we don't do it dollar for dollar is because when we do, it leads to excess utilization. It leads to rate increases not only on the gap policy, but it leads to rate increases on the underlying health care plan as well. We've discovered that if you take the skin out of the game for the employee and make the benefits too rich, that it ends up leading to too many doctor visits, too many hospital visits, big rate increases a year or two down the road. In this example, this person has a $2,500 outpatient procedure, and they have the exact same out-of-pocket in the outpatient procedure with the gold policy as they do with gap, $1,150 to be exact. But if you look on the right side of this chart, you see the gap policy on the outpatient procedure. You'll notice that the out-of-pocket maximum when you pay the $1,500 deductible and 20% of the next $1,000 is $1,700 out of pocket. The gap policy pays $750 and the employee pays $950 out of pocket compared to $1,150 with the gold plan. This chart's very important because it shows you that with inpatient procedures, your employees are going to be better off with the silver plan and a gap policy in virtually every instance they would be with the gold plan. You'll notice on a $2,500 claim, as we showed you earlier, it's $200 out of pocket with the gap and $1,150 without the gap. On a $5,000 claim, your employee will pay $700 out of pocket with gap and $1,400 out of pocket without gap. On a $10,000 claim, your employee is going to pay $1,700 out of pocket compared to $1,900 out of pocket without gap. So in all of these scenarios, your employee is better off with gap when they have an inpatient procedure. This chart shows you when gap is not best for your employees. It's important that we noted in 9% of situations, your employee will be better off without the gap. And this chart shows you where that 9% really is. If you notice, on all the procedures below $5,000 on an outpatient basis, your employee is better with gap than without it. If we get into a situation where at $5,000 in outpatient claims, you'll notice that's the break-even point. At $5,000 with gap, they pay $1,400, and at $5,000 without gap, they pay the same $1,400. When you go above $5,000 in outpatient procedures, your employee will pay more with the silver plan and gap than they will if they'd stayed with the gold plan. That will show you when gap may not be in the best interest of all your employees. We want you to understand, bringing in gap is a creative way to shift the cost of the health care from the healthy well that are not utilizing the coverage to the higher claimants, the people that are having heavy utilization that are driving your health insurance rate increases. This shifts the burden from the healthy well to the people who use the health insurance the most, the heavy utilizers, they'll have to pay more because they're using the plan more. What you're going to find is the overwhelming majority of your employees are going to be ecstatic and love the changes to their health insurance, much like the person who was repairing the copier in our office. You as an employer may actually mitigate a rate increase the first year. In some instances, bringing in gap brings the overall price down to where you may not have a rate increase at all on your underlying health plan. It also gives better coverage to 91% of your employees. The gap plan that your independent associate here is recommending to you is underwritten by Companion Life. Companion Life is in the rarefied air. They're an A+ rated company by AM Best. Companion Life is a wholly owned subsidiary of Blue Cross of South Carolina. When your employees explain to the people at the hospital or the doctor's office that this is a fully insured plan underwritten by a wholly owned subsidiary of Blue Cross of South Carolina, the acceptance rate of this is overwhelming. In the state of Alabama, over 99% of the claims are filed directly from the hospital or the doctor's office with Companion Life. With many of our competitors, the doctor's offices will not file the claims, and those employees are forced to file their own claims. All in all, this can reduce your overall cost for your health insurance premiums, and all in all, it can increase and improve the benefits for the overwhelming majority of your employees. For an employee to participate, they must be participating in your underlying group major medical plan now. If they're not on your plan now, they cannot be on gap. If they're on your plan already, then their gap is guaranteed issue. They can't be turned down for any reason other than not being on your employer group. You must have a minimum of 5 lives to participate, and we think you're really going to love the simplified claims process. The other component in this equation is the third-party administrator. This is the person that actually pays the claims. We're working with the largest independent TPA or third-party administrator in the country in key benefit administrators. KBA and Companion Gap have been working together since 2005. Overall, the company has only had one rate increase in its history of about 4% about 3 years ago. Except we noticed in the state of Alabama, there were some rate increases the last couple of years. We noticed that people were getting big benefits in the doctor office visits to where the employee was not having to pay to go to the doctor's office. There were instances where employees were going to the doctor's office more than one time a day. What we've worked with carefully with key benefit administrators and Companion Gap is what we call Sustainable Gap. Sustainable Gap is a trademark name by Providence Benefits. And Sustainable Gap means the way we recommend plan design, your plan should have minimal rate increases if you follow the strategy that we give you. Our strategy is you should not pay for doctor's office visits, or at most no more than half. We know beyond a shadow of a doubt that big benefits on their doctor office visit, while being very popular at the employee level, lead to heavy utilization, which means to big claims, which leads to rate increases. So what we want to do is create an environment where the employee is still incented to not go to the doctor at the drop of a hat because it's going to cost them some money, but with Gap, it's not going to cost them nearly as much as it could. We want to thank you for investing your time in watching this video. The person who brought it to you is an insurance professional, and they are concerned about doing the right thing for you and your group. We'd love to be a part of your program. We have people on our staff that have extensive backgrounds in claims experience and customer service that will work carefully with the representative that's asked you to watch this video to make sure that you get the type of service that you need to work with your employees. We hope that we can be a partner with you as we can show you additional ways to reduce some cost and improve the quality of benefits for the majority of your employees. Thanks for joining us. We hope you have a great day.